Hi, I am Dr. Murat Cantaşdemir. I am interventional radiologist, mainly working on tumoral treatment of liver. I'm working on interventional oncology. Interventional oncology is a side branch of interventional radiology. It consists of some tumor and cancer treatment with targeted treatments and local regional treatments. Mainly the treatment options are tumoral ablation, chemoembolization, and radioembolization. Tumoral ablation means that when you put the cancerous tissue, a special needle, you can give energy to the cancerous tissue. So, in the cancerous tissue, the thermal damage kills the cancer. This means tumoral ablation, like RF ablation and microwave ablation. Another treatment modality of interventional oncology is chemoembolization. In chemoembolization, we use angiography. We give chemotherapy drugs-loaded microspheres to the feeding vessels of tumor. So these microspheres emitting chemotherapy drugs into the tumor directly. These chemotherapeutic drugs we usually used in microspheres in chemoembolization into the feeding vessels of the tumor kills the tumor cells. So another treatment option is radioembolization. In radioembolization, we also use angiography, and we also use the feeding vessels of the tumor. So we give microspheres also, but these microspheres contain radioactive particles. When we give these microspheres to the feeding vessels of the tumor, they emit slowly radioactive particles, and these particles destroy the tumor cells.